Good morning, everyone, and thank you for joining us for our virtual press conference. It's my pleasure to introduce Dr. Libby Saunier, the Executive Director of the Louisiana Policy Institute for Children.
Thank you. Good morning, and thank you for joining us today. My name is Dr. Libby Saunier, and I'm the Executive Director of the Louisiana Policy Institute for Children. I'm honored to serve as the MC for today's virtual press conference. Throughout today's program, we invite you to type questions into the chat box. At the end of the program, there will be a question and answer session when we will attempt to address any inquiries. As an independent source of data, research, and pertinent information for policymakers, the Policy Institute for Children works to shed light on the state of early care and education in our state. On June 5th, 2020, Louisiana moved into phase 2 of reopening of the state amid the COVID-19 pandemic. Under phase 2, ratio and group sizes for early care and education providers returned to pre-pandemic levels for children ages 2 and under. Ratios and group sizes for children ages 3 and up increased from phase 2 levels, but still remained below the pre-pandemic allowances. With this backdrop, the Louisiana Policy Institute for Children conducted a third survey of child care providers from June 15th through 22nd, 2020, over a week into phase 2 of the reopening. Our previous 2 surveys conducted during the pandemic found serious concerns about the financial viability of the early care and education sector in our state. The June survey again asked child care providers what impact COVID-19 was having on their program or business, including financial losses and closure decisions, and what supports were needed to help providers respond to the public health crisis. Additional questions about reopened centers and government grant programs were added. Results from the June 15th through 22nd, 2020 survey show the continued challenges and realities facing child care providers in Louisiana as the COVID-19 pandemic stretched into the summer and the state began reopening. The findings and conclusions we are going to share with you today speak to the state of early care and education sector in Louisiana and the essential investments necessary to fully reopen Louisiana's economy. Before I introduce our next speaker, I want to take a moment to thank our partners, without whom our work would not be possible at all. They are Agenda for Children, the Child Care Association of Louisiana, the Child Care Connections for Northeast Louisiana, the Louisiana Association of United Ways, Northwestern State University, On Track by 5 Alliance, Point Coupee Early Childhood Coalition, the United Way of Southeast Louisiana, and Volunteers of America. At this time, it is my great honor to introduce Sonia Joseph Brown. Sonia is the co-owner and executive director of Clara's Little Lambs, an early care and education center in New Orleans. She has also generously volunteers her time with the Louisiana Policy Institute for Children on our board of directors. Thank you so much for joining us today, Sonia. Having a little technical difficulty. Hold on just a moment. We'll just go ahead and move forward. So what I know is that as an owner of 2 child care, early care and education centers, Sonia really can speak firsthand to the struggles that providers are facing throughout this pandemic, which leads us to our first key finding. The first key finding in the Policy Institute's most recent survey shows that financial losses for providers have continued to grow substantially during the pandemic. In fact, 77% of providers who responded to the survey reported experiencing substantial financial losses due to COVID-19, with losses averaging $110,000 per center as of June 22nd, translating into an estimated $137.5 million in collective losses statewide. The financial losses experienced by the early care and education sector, like Sonia's business, will likely only continue to grow as providers struggle to balance maintaining health and safety environments for children with reduced enrollments, resulting in part from required lower teacher to child ratios, and increased cost. I hate that you couldn't hear Sonia deliver that, but what we know is that those losses are real for her and her child care centers, and as well as the child care centers across the state. Next, it's my pleasure to introduce Dr. Timothy Magner. Dr. Magner is the president of the Greater Shreveport Chamber of Commerce.
Thanks, Libby. It's delightful to be able to be here with you this morning. This is really important work, and I appreciate all the work that you and your team are doing to make it available to us. According to the Policy Institute's most recent report, about 80% of providers during the survey window were serving fewer children in June than they did in January before the pandemic. And on average, enrollment at open providers was about 30% less in June than it was in January. So there are a number of reasons why enrollment is lower at so many early child care and education centers. Some providers reported that parents are keeping their children home, which is understandable. But providers are also operating with smaller group sizes because of the requirements of the governor's order and the phase 2 scenario in order to protect the health of children and of staff. And early care and education centers cannot viably continue to operate with their clientele present, without their clientele present to keep their doors open. And this presents us with a really cyclical problem, because if centers close or raise tuition in an effort to cover their losses, then working parents will struggle to return to work without ready access to affordable quality child care and education for their children, which then will in turn impact employer productivity and economic recovery. So having our child care centers open and available for parents is a critical piece of our economic viability going forward.
Thank you so much, Tim. It's my pleasure to now welcome our next speaker, Assistant State Superintendent at the Louisiana Department of Education, Dr. Jenna Chason. Thanks for taking time out of your busy schedule to be with us today, Jenna.
Thank you, Libby, and thanks to Libby and the entire Policy Institute staff for their consistent and thorough research throughout this pandemic. At the Louisiana Department of Education, we're committed to raising the bar for all early childhood programs and preparing every child to enter kindergarten ready to succeed. Throughout the COVID-19 pandemic, our department has been focused on helping school systems and the early care and education community address unfinished learning from the 2019-2020 school year, set the foundation for continuous learning in 2020-2021, and prepare for potential modified operations in the future. We recognize that early care and education providers need our financial support now more than ever. In recognizing this, it is my duty to report the second key finding from the Policy Institute's most recent report. Almost half of providers, including those that were closed during the survey window, had a waiting list of families hoping to enroll their children. At the same time that some parents are waiting for a spot to open, the survey results also suggest some parents are deferring when they return their children to childcare, compounding the financial difficulties facing providers with fewer tuition-paying families. However, working parents will inevitably need to be able to put their children back in an early care and education setting in the future. And when they do, they will be facing an early care and education sector where some providers may have closed permanently and others already have a wait list. We must do our diligence to ensure there are enough open, quality early care and education providers with available spots to serve those families and ensure that their children arrive at kindergarten ready to succeed.
Thank you so much, Jenna. I know you and your team at the Louisiana Department of Education are working hard to help address these needs. Next, I'm pleased to introduce Dr. Rachel Chatters, a pediatrician and the chapter president of the Louisiana Chapter of the American Academy of Pediatrics.
Okay, thank you for the introduction, and thank you to everyone for participating in this report and its critical findings. The Policy Institute's most recent survey shows that more providers experienced challenges with purchasing necessary cleaning supplies and personal protective equipment. In fact, almost 2/3 of providers reported difficulty in obtaining needed supplies, including cleaning supplies and PPE. On top of that, 67% of providers experienced increased costs for cleaning supplies. With new health and safety protocols in place, having the necessary supplies on hand to ensure that these new measures can be implemented is crucial to the early care and education sector being able to maintain open and serve working families, to remain open. And without sufficient PPE, the cleaning supplies, et cetera, our most valuable and vulnerable population of children and frontline workers are at risk for catching and spreading COVID-19. And additionally, PPE and cleaning supplies enable early care and education centers to properly enforce social distancing procedures and sanitation between classes. For the providers who are able to obtain these supplies, the extra cost is further eroding their financial viability. And so moving forward, we must make investments to ensure that providers can obtain necessary PPE and cleaning supplies to keep our communities healthy and maintain affordability for families.
Thank you so much, Dr. Chatters. We really appreciate you taking time out of your busy schedule to be with us today. Now, but certainly not least, I'm pleased to have Bill Hammock with us today. Mr. Hammock is a senior partner at the Link Restaurant Group.
Oh, thank you so much, Libby, and I'll echo what the other speakers have said about the tremendous work that you and the team is doing since this organization came into existence. Its contributions to helping our legislators and our community leaders understand the importance of childcare and early learning has been tremendous. So thank you very much for that. I really appreciate you including me in the call today as well. And obviously, as we saw earlier, these don't always go exactly as you expect them to, but it's good to see all of you today. I'll put that in quotes, but thank you for tuning in. It's crucial to remember that early child care centers are all small businesses. They were on razor-thin margins before this pandemic, and obviously things are much worse now. Less than 1 in 4 open providers expect to be able to financially survive long-term operations and the current smaller group, with the current smaller group sizes that they have in their centers. The recent findings reveal that only 22% of providers open during the survey window, including those that had closed and then reopened or remained open during the early part of the pandemic, said that they could afford to continue to operate and continue to do business based on the current group size. By contrast, 35% predicted their business could last 6 months or less, and another 42% weren't sure. Obviously, we know that there's been federal and state aid provided to early child care providers, but that simply offset part of the loss. It certainly didn't cover 100% of what they've had to endure and the losses that they've sustained. As this pandemic drags on, the financial viability of these providers become more and more at risk. Obviously, moving forward, we need additional investments to ensure there is a child care sector for working parents and also for their employers. This is critical for Louisiana businesses and the economy to be able to bounce back. Again, as someone who's been in business for many, many years, and I know just how important it is to my team members that they have quality care and education for their children. I know that the impact that this has on their on our business if they're not able to have a place for their children to go, and certainly the same would be on all other Louisiana employers. We simply cannot afford to overlook this critical and very important component of our economy as we move toward recovery.
Thank you so much, Bill. Thank you to all of our presenters today for taking time out of your schedule to help us present these results, really about this important conversation that we've been having over the last few months, but in particular today. As Louisiana remains in phase 2, in light of the continued spread of COVID-19, we know that all recovery plans must include additional investments in the early care and education sector. As a reminder, prior to COVID-19, 2/3 of children aged 5 and under in Louisiana had both parents or a single parent in the workforce. For those parents to return to work or job training, they must have access to quality, reliable early care and education for their children. There are many unknowns still ahead, but one thing is for sure. Without increased investment in the early care and education sector now, facilitating access to quality, reliable early care and education, parents working across every industry will not be able to return to work to provide for their families and keep our economy in Louisiana moving forward. The Louisiana Policy Institute for Children plans to hold another virtual press conference to present additional findings from a statewide survey of working parents with young children this fall. Please stay tuned as we release that data later in the fall. At this time, we are going to proceed with question and answer portion of the event. Please type any question you have on findings from today's report into the chat box. I don't see any questions just yet, so if you have them, please feel free to type them in the chat box. You can see as well that we will have an electronic copy of the report on the Louisiana Policy Institute for Children's website, where you can download the first report that we did on the impact of COVID on child care providers in our state, and the second one, and we'll now have the third one up as well. Well, seeing no questions, we can't thank you all enough for joining us today. Again, this is an important topic that we know is vital to the economy of Louisiana, and vital to our families being able to, really provide for their children, because we all want what's best for our children and we all want what's best for our state. Thank you again for joining us today, and stay tuned as we release further results as time goes on. Thank you so much.